Hi, my name is Bern, and this is a continuation of the unscheduled documentation, so this will be part 2. So over here we're at the patient desktop again. This is where the small house and the little person is to navigate back to this screen. Unscheduled documentation will be here on the left side once again, so I'm going to go ahead and click there. And previously, I explained the documentation on updating allergies and completing the ticket to ride, especially when patients go for procedures. I will continue to discuss physician with SBAR and critical results readback. Physician with SBAR is when you contact the physician, especially when it comes to a change in patient condition. So we're going to go ahead and do an example. So I'm going to go ahead and select number 14. So I'll click once, and then I'll click OK. Again, it's asking for the date and time, so you always want to do real-time charting and click OK. Now it's asking for the patient situation. So over here, you'll notice you have some options. You have a change in patient condition, change in vital signs, abnormal labs, and then if you continue scrolling to the right, you'll notice other items such as radiology, for example, abnormal chest x-ray or abnormal EKG. So in this case, let's do a simple one. We'll do fever. So I'm going to go ahead and click this one, number 17. I'll click OK. And it's asking for the abnormal temperature. So let's do 101 degrees. I'll click OK. It's asking for the background. You can fill out this information if you'd like. In this case, I'm just going to put patient admitted for abdominal pain. Click OK. Assessment. Temperature is 101, and patient is complaining of chills. So I'll click OK. This one recommendation, I'm going to click Go To. Here it's going to ask me to select Field to Edit, so I'm going to select Physician Contacted. So in this case, you're going to select and look up the physician that you called. So in this case, I did call this physician right here. So I'm going to type in the first few letters, and I'll put a dash, then I'll click OK, and then I'll select this one. So what I did with that one, I just double clicked it. It's asking you for the time here on number 6. So I'm going to put N for now. And then it's asking for the method, so I'm going to click there. I'll select number 2, click OK. Outcome, let's say he called back, it was successful. I'll click OK. And then number 9 is asking if I received any orders. So I'm going to select New Orders. Click OK. Patient response. So I'm documenting that the patient's complaining of chills. And so I'm going to also indicate that cooling measures were initiated. Okay, so I am just documenting what I'm observing. and I'll click OK. I'll click OK once again, and then I'll click Accept to file it. So that's how you complete a physician with SBAR, physician notification with SBAR. So I'm going to go back to unscheduled documentation. Another one I would like to go over is critical results readback. Let's say your patient's potassium came back 6.0. Lab calls you and notifies you that the patient's potassium is high. So you want to go ahead and select this option, item number 15, click OK. I'll click OK. Received by. So you have some selections here. You have your phone, fax, verbal, written. Normally the lab calls you with the critical lab value, so you want to select phone. It's asking you to enter the employee received. So you always want to make sure you ask for the employee's name and first name and last name. So this is the phlebotomist who gave me that information. So I'm going to select item number 1 and click OK. Date and time results obtained. So I'm just going to put N for now. Click OK. Test. I'm going to look for potassium, which is number 18. I'll click OK. Potassium level 6.0. I'll click OK. Now it's asking you result readback. What this indicates is that it's asking the nurse, did you confirm the results with the phlebotomist? In other words, did you tell the phlebotomist, okay, the patient's potassium is 6.0. You just want to make sure you confirm that result back to the phlebotomist. So you want to click yes. Were results read back to the calling party? Yes. Physician notified, you want to click yes if you call the physician. So I'm going to type in the first few letters of the physician's name, last name. I'll put a dash. Click OK. Now it's asking for the time. I'm going to go ahead and press N and click OK for now. I selected paged physician, so I'll click OK. Outcome was successful. I'll click OK. And I'm going to select new orders because the physician gave me new orders for the patient. Here you want to make sure you indicate if you want to add a comment or not. This is important, especially if you make an assessment of the patient, especially if they're symptomatic. So in this case, I'm just going to indicate that the patient is asymptomatic. So I'm just going to click OK and click Accept. Okay. So going back to the unscheduled documentation, there are several items here that are available for the nurses to fill out, especially if the patient experiences any acute change in condition, such as pain assessment. Also, we have the pneumonia and flu vaccine. If you want to update the influenza, you can go ahead and do the same thing and select that item and click OK. It's going to be asking you if the patient, if it's flu season. In this case, it is. It's still March 27th, and we're still in flu season, so you want to click yes. Now you want to click document influenza screening criteria. Let's say my patient's 62 years old, so you want to select 1, unless they received an organ transplant. Click OK. Exclusion criteria. These are the list of items that exclude the patient from the vaccine. So this patient does not have any exclusion criteria. So let's select number 10. Click OK, and it's going to automatically generate indicated. And then once you click OK, it's going to navigate you to this screen, and then you want to click OK and click accept, and it'll automatically schedule an influenza vaccine for the next day. And then you will be able to find that in your MAR. Otherwise, that should be completed. That should be complete. Thank you.